Good evening, everybody. My name is Michael Freeston, Director of Quality Improvement, and I'm welcoming you to this evening's webinar, the latest in our series of Welcome Back sessions called Keeping Up to Date. As ever, I'm joined by my colleague, Melanie Pilcher, Quality and Standards Manager at the Alliance.
Good evening, everybody.
Can you hear me? Oh, thank you, Melanie. Oh, a pregnant pause, thank you. For those of you, for those of us who were with us a couple of weeks ago when we last did a webinar, we had planned that the next schedule one, in response to demand and questions we'd had from members of the audience, would be on supporting children with additional needs as they return to our settings. And we will do that, and we are making the final details arrangements for that. However, because there were some changes that were announced by government into the latest guidance and guidelines, came out last week, as you'll become aware as we go through the session, we thought we would do a quick turnaround session today to try and bring colleagues up to date and to consider the implications for that. So I'm grateful to Melanie for turning around the information so quickly, and to yourselves for joining us at such short notice as well. So that people don't feel as though they have to make copious notes and scribble all the time, we will email the slides to everybody who is registered for the session, and also we will make this recording available on our YouTube page, which you can access from the Alliance's homepage. Should be there, all being well, by tomorrow evening. So that's Wednesday evening. Okay. Moving forward. Just your picture of your hosts, that's me on the left, sporting yet another lockdown haircut, courtesy of my wife, and Melanie, who's with us. I don't know who's doing your hair at the moment, Melanie?
Nobody at the moment, Michael.
Okay, great. No, I'll move on. Right, the aims of today's session. What we're going to look at is to highlight the most recent updates that have come from government, and also you may well have picked up there have been some announcements from OFSTED as well, and we will wrap those all up into today's session. We will also give consideration to how the recent changes will impact on you, the providers, and also the points here is what are the main focuses, but also you will see from the information and also what the general guidance has been in terms of easing lockdown generally, there is a movement away from enforcement by government in terms of this is against the law to very much more a process of they are creating an enabling environment, and it is up to us to ensure the safety of ourselves when we're in pubs or in restaurants or wherever we're going, but also how that implies what that means for us in the professional sphere as well. There are less regulatory requirements and laws, but we still have to ensure that the children and families who we serve are safe. And so it's very much our sharing our considerations of what this implies, but also we would like those to come from you as well, because you are living this as we go forward. So your experiences, knowledge and expertise are vital, and we would like to share those with colleagues as we go forward. So if you have any examples of particular strategies which you're using in your provision, please do share them, because it's valuable for us in as much that we can share them with the colleagues who are online now, but also we feed these back to DFE, to policymakers, to demonstrate how creatively and safely the sector is responding to the requirements. Just the final slide from me before I hand over to Melanie. The web link there, please again don't try and write it down, this will be available on the slides, takes you to the latest government's guidance, which was published on July the 2nd, whenever that was, sometime last week, updating the information that was made available, and also I'm always keen to direct people to the Q&A page on the Early Years Alliance. Our colleagues do an excellent job in turning around information very quickly, getting it posted, making social media messaging available, and they are regularly updating this. So if you miss anything today, or if you have any other questions, you can visit that page, but also post your own questions as well to us, and we will endeavour to get authoritative answers for you if we can't answer them directly. From that, I shall hand over to Melanie. My task now is to take from you any questions, comments, and feed them seamlessly into Melanie's Melanie's presentation. Don't feel as though you have to wait until the end to write any questions. Construct them as they come into your mind, and I will try and introduce them as best we can. Melanie, over to you.
Thank you very much, Michael. It seems like we've been feeling our way for so long, very tentatively, with everything that we've done in early years. And it felt like when we got the new guidance out, we were taking actually quite a big jump forwards in terms of what we could and couldn't do. So it will be good this afternoon just to spend some time reflecting on that and what that actually means to practice. So as Michael said, please feel free to type in questions as we go along, and Michael will actually stop me at the appropriate point and ask those questions. There will be changes to the guidance regarding shielding that will come into effect from the 1st of August, so we'll have a little look at that. And of course, there is new news from OFSTED as well on their intent to resume inspections from next year, but also what's going to be happening in the meantime from September. So really where I suppose we've just felt like in some respects, the pressure's been off a little bit in terms of, you know, could Ofsted walk through the door tomorrow? We've now got to start thinking again and just making sure that we are, as we always are in normal times, Ofsted ready. Okay, Michael, if you can move us on.
Oh, pointed on the wrong slide. Sorry, hang on, just let me.
That's okay. Right, so the big news then was that, I'll just say actually before I go on, the numbers that I refer to on these slides are all from the guidance that you've got the link to on the first page there. So when I refer to 2.1, that is the actual place within the guidance where you will find the additional information. So section 2.1 tells us that there is to be a change to the protective measures, removing the requirement to keep children in small, consistent groups, as we call them, bubbles or pods or cohorts. And that comes into place from the 20th of July. So we're really talking a very short period of time now when actually we will be welcoming back a lot more children. The guidance reminds us that we should still consider how we will minimise mixing within your settings, for example, keeping those cohorts, the baby room, preschool room, etc., apart as much as possible. And a few things you might want to think about as we move on then. Just ask Michael to press the button.
Sorry, apologies.
That's okay, that's okay. You must be reading a newspaper there, Michael. I'd like you to think about how you will achieve this if you operate from a single room, because obviously the challenge there is to minimise that mixing, but we know that some of the community halls, the village halls, will have partitioned off areas in those large rooms. So just thinking about how you can actually manage that situation and how many places can you now offer safely. So you're really going to need to reassess the number of staff that you've got available and actually measure that against the demand from parents as more and more children can come back. So lots to think about there. Yes, Michael.
Can I just pick up, because Rachel has submitted something which I think is timely for exactly this circumstance. She was saying that they've been, they're very fortunate in as much that they currently have a large outside space, a field and an enclosed car park. We've found outdoor learning, and this is music to your ears, Melanie, found outdoor learning has come into its own over the last few weeks. This will now, what she's saying is this will change later this year when our setting is moved into a permanent build with limited space, and she's interested in how others will cope. But also I think it rephases another thing is, in the summer, all of this may all be fine and dandy. As if this situation moves into the autumn, the winter, into the early spring, then clearly the weather begins to play a factor in terms of how settings and parents feel comfortable in terms of how their children are being cared for.
Yes, and it's certainly something, as you know, Michael, I've promoted a lot, is the benefits of taking that learning outdoors and making the most of your outdoor area. And I can only quote Maria Montessori, who said there is no such thing as bad weather, only bad clothing. So I just think that people will be more willing to give it a go. And I think, you know, you've got to bring the parents along with you. But I would like to think that a lot of the good that's come out of this and the way we've changed our provision, we can actually carry on through into the autumn at least.
And there's a second point that's coming from Cheryl on that, in terms of with the movement away from bubbles, presumably it's still the emphasis, as it always was, in terms of recognizing that social distancing is practically impossible with young children. So it is about the hygiene arrangements and how we do that, notwithstanding the ability that children want to be very close to each other when they're playing.
It definitely is. And as we move on, you'll see that there's additional guidance within this guidance, and actually that's very much based on risk assessment and health and safety and infection control, so that actually we can get back to something that's a little bit more like normal, but actually enhance those infection control measures that we've got in place and that we've all done so really, really well with up until now.
Just one final question before, well, I'm in control of the button, so you can't move on until I get there.
No, I can't.
How, and it's a question from Sarah, how would a childminder now decide how many places to offer is safe? I currently collect 6 children from school, all from different classes. So again, it's how do we give consideration to that in terms of places?
Yeah, and there's nothing to stop you from doing that. But again, it's just those things around. We know that the scientific evidence tells us that children are more unlikely to actually be safe from actually transmission and from actually contracting coronavirus in the first place. So really, the group of children from different settings or different classes or bubbles is not so much the issue, but it's how you maintain good infection control to make sure that they don't actually take any potential infection back out of your setting with them. So I think really childminders, you still got to do your risk assessment, still keep all those protective measures in place, but you really can think more now about getting back to a normal service and offering those places out as you would have done previously.
Thank you. And Cheryl has very kindly reminded me, she's unwittingly done this, reminded me of something I meant to say earlier on about the questions and answers. She's asked about whether what we're talking about is for nurseries and preschools, not related to out of school clubs. One of the things that one of our colleagues was talking about, who's in charge of the question and answer sessions, is we are still pressing DfE for clarity around out of school provision and baby and toddler groups. There have been announcements about summer schools where bubbles again have been relaxed, and so that's making those viable, but there is still some clarity required in terms of circumstances for out of school provision and baby and toddler groups.
Yeah, and they have eased off a little bit, because one of the new pieces of guidance within the guidance is around out of school clubs. So what we're talking about today and the guidance that's been updated is for all providers on the early years register, including wraparound and before and after school and holiday care, and of course all childminders and anybody with a childminder agency. So there have been a few little tweaks here and there, and obviously, Michael, I've spent quite a lot of time looking at the guidance in detail, so I'll highlight those things as we go along.
Thank you. I'll let you move on.
Thank you. So in section 3.1 and 3.2 of the guidance, we talk about risk assessments, and you will need to review all your risk assessments for wider opening. This is what's being asked of you. And I'm going to refer to this again later as well, because OFSTED have also made an announcement on how they may be looking at your risk assessments come the autumn term. Put in place systems to monitor that your controls are effective. So as with all good risk assessment processes, you should have some kind of system whereby you monitor or at least evaluate the effectiveness of the controls that you've put into place. And if you haven't done that, then I strongly urge that you actually go back and look at the risk assessments that you've done up until now and just reevaluate them and make sure that everything's still working. Yes, go on.
Sorry, no. I was just reading some questions and I've missed where you'd got to. Sorry, was that the end of that section before I move on, or?
Just a little bit on the third bullet, just to say that the guidance accommodates additional measures for those people who may be at increased risk from coronavirus. Because again, I will explain in more detail in a moment. But actually, there's a lot of things that have been relaxed. That means more children can actually start attending, but you still need to put in those extra measures to actually protect anybody that might need the additional protection. Okay.
Yes. Sorry, no, just there's something just from Lorraine, a very interesting one. Lorraine says she lives and works in a setting in Leicester, which has been closed down again in response to the local lockdown.
Oh gosh, yes.
People need to be aware that local restrictions can be reintroduced, and it really feels like a backward step. Is it possible, and this is something I hadn't thought about, and I think we will get onto this with the DfE, is it possible that guidance will be made available specifically about what needs to be withdrawn or reinstated in case of local lockdowns being announced? Because it's hard to know how far back to go, and I think that's a really interesting question.
Yes, and they have kind of alluded to this a little bit in this revised guidance, but not in any huge detail. So it's certainly something that we're going to have to really keep an eye on, because it does say that in exceptional circumstances there may be settings that are going back into lockdown, and this is where Public Health England and the health protection teams will be involved much more closely. And will be advising individual settings and provision as they go along as well.
Because it probably takes you back down the timeline, doesn't it? In terms of,
yes,
we're back to the situation in Leicester of where we were in March and April, and the question is how fast do they move out of that?
Yes, yeah.
And so that would come from local public health circumstances, wouldn't it?
It would, although I must admit on my news feed this afternoon, I did see that the cases in Leicester have dropped again significantly already. So whilst I don't think there are any plans to actually lift those restrictions for the time being, they're certainly seeing that, that's had a positive effect straight away. And I think as we're just seeing these pockets of increased infection, I think where they can take that action quickly, obviously it'll be easier to measure the impact of that quickly as well. So that's something positive coming out of it. Okay, Michael.
That's fine. Yes, let's move on. The series of questions that have just come in, I think I can be confident to everybody that Melanie will cover them as we go through. If not, I'll come back. Thank you.
Brilliant. Okay, so some things to think about then, because the risk assessments are so very important. They've always been important in this process, but now is the time to go back, refresh them. If you're a bit concerned or worried about what risk assessments you should be doing, then I'm going to refer you to the welcome backpacks that we put together for you, because we have those risk assessment templates in there, and although now they seem to be almost out of date because we're a few weeks on, actually the fundamentals of what's in those packs is still sound. Think about how you can share those risk assessments with parents and other people, because again, it's really important that parents understand what you're actually doing and the measures that you're putting into place. And you may well be asked to share them with OFSTED if you are one of the settings that has a visit from OFSTED. And I'm going to talk about that later as well. And don't forget to involve your older children in your risk assessment process too, because as we know so well, children will pick up on things that we wouldn't even have considered. So why not make it a learning opportunity and a chance to give them a little bit of control over what's happening in their world as well. Okay, Michael, if we can move on. And the biggest change in the guidance is in section 3.3, where we are now given a system of controls. And what they actually have done here is introduced a specific 6-point system of controls, plus an additional 3 measures that must be put in place in response to any infection. Now, there's nothing particularly new in here. What this has done is brought a lot of the guidance together and actually put it into a very simple, systematic process for you to follow. And this includes prevention, which again is something that we've all been really hot on. We're all very well aware of the guidance and what it says. Hygiene, enhanced cleaning, minimising contact between groups, between those who may still be shielding and those who are not. Reference to PPE, that's your personal protective equipment. And I do hope that you've all downloaded your doffing and donning guide from the NHS website. If you haven't, please do, because if you're not using your PPE correctly, you may as well not be using it. I saw a gentleman in the shops just the other day who very cleverly got his gloves on and he got his mask on, and when he finished his groceries he took off his mask and then took his gloves off with his mouth. So it's just, you know, it's just those simple things, and actually how you take off your PPE that's so important. And then what is newer is how we respond to any infection and the process that must be followed there. So lots to think about there, and I can only direct you back to this guidance for the detail. I'm just looking down my list now.
Sorry, Melanie. Just a point that's come from Jean, and just to, I think it's worth sharing and elaborating on. The guidance about, it's your last one in terms of response to any infection.
Yes.
The responsibility of early years providers to notify, track and trace systems in their area if there is any confirmed case, and public health.
Absolutely. It says there quite rightly, as just was said, settings must ensure they understand the NHS test and trace process and how to contact their local Public Health England. You should have your Public Health England number, your local health protection team number available. And I think I'm right in saying that we will be seeing further guidance coming out shortly, which is much more of a sort of flow chart that actually doesn't replace this guidance, but is actually just more of an at a glance what you need to do. So my suggestion is, and if we can just click on Michael for what you need to think about, these 9 points are what I would say in effect your additional procedure. So I think what you need to do really is think about how you can either use them to update your existing procedures in terms of health and safety and infection control, or how you can actually isolate them from this main document, cut and paste or whatever you need to do, so that you can actually just then add them wholesale into your current procedures. But rather than writing new procedure from scratch and how you're actually managing any incidents of coronavirus, they've done it for you here, so make the use of the guidance that's available. And then, of course, unless you share it with all staff and ensure that everybody is confident in how to implement this, then, you know, it can't work properly. So make sure that you share this, that you have a chance to sit down as a team and talk about this. Okay, Michael, if we can move on. And then section 4, this is quite a large section again in the guidance, which talks about attendance. And several things have been tweaked here, so I'm not going to go into detail of all of them now, again referring you back to the whole guidance, but we are now saying that all children are strongly encouraged to attend the early years setting. And in future, far fewer children are advised to shield, because the shielding advice for all adults and children will pause on the 1st of August. So this means that even those children on the shielded patient list can return to their setting, as can those who have family members that are shielding. And if any children are shielding for medical reasons, if they have an ongoing existing medical condition, settings are being asked just to get the parents to check with their medical practitioner to make sure that it's okay for them to come back, and, you know, to see if there's any additional measures that need to be put in place to actually make sure that they can be coming back. And this is very much about enabling people to come back rather than concentrating on keeping people away.
Just a couple of questions that have come in related to that in terms of children attending.
Yes.
First of all, a general point from Natalie in terms of, does this mean that children can now attend multiple settings? And related to that, Stephanie asking about shared care with grandparents who are not necessarily classed as vulnerable. Is it acceptable? So it's both questions, I think, relate to the issue that children are in various social environments, aren't they? And how does that impact on their provision with each individual provider?
Yeah, and this is very much, it's a big step to getting back to a normal service, really. So if children are attending more than one provider, it's not ideal, but we understand that if we want parents to go back to work and we want to get back to a normal service, in some instances, this is going to be necessary. So it is about thinking about having that dialogue with that other provider to make sure that you're both absolutely clear about what steps you will take, if there are any concerns, and making sure that you share information with each other and talk about your risk assessments together, and to see how between you and the other setting, you can actually minimise any risks. And again, it's that enabling factor rather than actually saying, well, this must not happen. So yes, it's simply talking to that other provider. And there was a second part to that question, Michael, and I can't remember what it was. Was it
grandparents?
Grandparents. Yeah, again, the same thing. If there's no reason to believe that those grandparents are symptomatic or showing any signs of coronavirus in the first place, then that's okay, because the likelihood that those grandparents may well be part of that family's support bubble. So again, we need to ensure that we enable that situation to actually happen. Okay, so shielding advice for all adults and children will pause on the 1st of August. This means that even those, I said that bit, but the shielded patient list I've talked about. The content about vulnerable children has been removed from this section. So where we were talking about there would be reasons why some vulnerable children couldn't attend the setting, that has actually been removed, because again, it's about enabling those children to attend. And it's only in very few cases that won't be possible. And final bullet I've already covered. Some children under the care of specialist health professionals may need to discuss their care at their next scheduled appointment before returning to the setting. So it's not a case of parents ringing up their hospital or clinic and saying, I need an appointment so we can sort this out. This is just a case of having that contact as and when to make sure that things are okay. Okay. And I mentioned earlier about wraparound care. So we have a little bit of additional information about wraparound care. And we are told that wraparound care on school or early years premises, and as of 4th of July, so already passed, wraparound care on other sites are now able to operate, with the proviso that they can follow all the relevant safe working guidance. And you will only know this if you have a risk assessment approach to deciding what you can do and how you're going to do it. Okay. So you might want to think about there, if you are certainly, any provision, not just the out of school provision, but if you happen to be in a provision which is shared premises, especially, we were hearing last time, weren't we, Michael, that a lot of settings were saying how nice it was to have the premises to themselves, especially those pack away preschools. And the chances are that a lot of those, for example, the uniform groups and so on, will actually be coming back to the premises. So you now have to reassess that situation and think about how risks to or from those other users will be managed. So again, it's that having that conversation with those other users, sharing your risk assessments with them, and just thinking how you might need to tweak those so that you're in line with each other. Okay, and if we can just move on. And they've taken the opportunity just to put in a little bit of information about the EYFS Reforms update. And it almost seems like this is just something that's in our peripheral vision at the moment, rather than something that we're focusing on. But the consultation into the EYFS reforms, as most of you will remember, closed back in December, and we've been waiting for the consultation response. Sorry, was it January? It was January. Consultation. Sorry. And that consultation response has now been published. So I'm not going to say too much about that, other than please have a look at our response to that on the Alliance website. The primary schools are still invited to be early adopters of the new EYFS in the 2021 academic year, so from this September. And statutory rollout of that revised EYFS, in other words, the revised early learning goals, is still planned for the 21-22 academic year. So in other words, from September 21. Please do read the consultation response and our guide to those changes, which is available to you on the Alliance website. And it's laid out quite nicely for you, actually, so you can see exactly what's changed and against what was previously there. Okay.
Cool.
And again, yeah. And now we have the news from OFSTED then. So in section 8.1 of this guidance, it's been clarified that OFSTED have been asked to work with the government and local authorities to find out who is open or closed and your settings plans for the future. And I think this is really about capacity, amongst other things, really. We know, that unfortunately some settings won't be coming back in September. We know that some settings are very close to the edge as it stands. So I think this is really about finding out what provisions there, what capacity we have to offer those places as we move back towards a normal provision. And also, Ofsted have told us that they will start, and I think this information's now in the public domain as well on the Ofsted website.
It was announced on the end of last week.
Yes, yeah. So Ofsted have told us and telling you as well that they will start visiting more early years providers in the autumn to see how you're getting back up to speed. So this is not an inspection. This is meant to be a supportive thing, really, so Ofsted can come out and see how you're getting on. The aim is to reassure parents, ministers and the public about how you are managing. They will monitor your progress and against regulatory standards during these visits. They will not be grading you and they will not be issuing a report. However, they will publish a summary after the visit, confirming, as they say, whether a provider has improved. So my insight into that really will just be, what have you done during the outbreak? How have you managed to maintain the EYFS requirements? How are you working with the disapplications and modifications? And that summary, I would imagine, would be quite helpful actually for providers to just see if there's anything that they just need to tweak and work on. And if we move on again. A few things that I think you need to be thinking about now is which of the disapplications and modifications have you actually had to make use of? And if you have, for example, if you paediatric first aid, if you've actually, you've got people that should have renewed their paediatric first aid and haven't, what steps are you making now to make sure that those can be renewed as soon as possible? If you have stopped delivering some of the learning and development requirements, why have you done that, and how actually are you still making sure that you are meeting the other things in the EYFS that you are still required to do? Can you demonstrate how and why, I think is going to be really, really important. And again, in the welcome backpacks, when those disapplications and modifications first came in, I did put together some audits, some risk assessments that would actually help you steer you through that process. Are you Ofsted ready? We talk a lot in the Alliance about there should be no need to make special plans for Ofsted coming because we're always Ofsted ready, and generally most providers are. But, some of us will have just eased off on some things. It's only natural that we have. So just thinking as a team, if Ofsted did walk in the door tomorrow, are we ready for them? Could you demonstrate as well exactly how you've kept up to date with all the current COVID-19 guidance? I mean, it's my job to keep up to date with this guidance and to make sure that I help to disseminate it. And, sometimes I find it really hard to think about what's changed and which guidance I need to be looking at. So I can understand that for busy providers and practitioners who are really that your main focus is the children, it's really hard to keep up to date with everything. So just being clear about how you've done that. And are you confident that despite all the extraordinary measures that you've put in place, you have not compromised on safeguarding and welfare? And I know nobody would deliberately do that, but I just think you need to stand back a little bit and just about it against welfare requirements and safeguarding requirements of the EYFS. in particular for those children who are vulnerable and those children who have special educational needs and disabilities. Because as we know, people are starting to ask those questions now, aren't they, about children with SEND.
Thanks, Melanie. I think we're getting a bit of waffling away on your microphone. Can you just make sure? But a question related to this whole issue in terms of disapplications, just coming from Rebecca.
Yes.
With regard to encouraging all children back, how does the ratio stand? Will it be as it was pre-COVID or to be reviewed? Thank you. Now, the disapplications, if I recall, are in place until September at the earliest. Is that correct?
They are in place until September the 25th, but the point here is that the ratio requirements never changed. There's always been the proviso with regard to ratios that in exceptional circumstances you can make changes to those ratios. So as you welcome children back, if you still need to make any changes to those ratio requirements, as long as you can justify and you ask yourself the question, is this an exceptional circumstance? Then fine, but those ratio requirements never changed.
Thank you. Are we?
I think we're more or less there, Michael. I think unless
I've got a few other questions, but if you take this slide, I shall just refine them. I'll scroll back up on my questions pane, and then we go from there.
That's fine. So whilst Michael's having a look through for the questions that have come in, I'd just like to say thank you for joining us today. Thank you to all of you that have taken the time out of your busy days to watch the webinar. The welcome back materials that we've actually put together, as I said before, although we're a few weeks on now from the original ones, they are still valid and still relevant, because the aim was always to make them generic enough and that they would stand the test of time as far as we possibly could. So please, if you haven't made use of them already, do just go onto our shop and order them. They're free of charge. The latest one, welcome back family services for unregistered provision, that would be baby and toddler groups, out of school groups, baby and toddler groups, creches and children's centres, so anything that's not registered by OFSTED. We're still waiting for some additional guidance on that, as Michael said earlier, but that pack will be ready for you so that you'll be ready to go with that. We've still got all our online Connect events going, and they're very, very they're up to date and relevant, so it gives you the opportunity as well to talk to each other, talk to other providers in a small and more intimate group of people. And those events have been really, really welcomed by the sector. So do go on to development at EY Alliance to find out what's actually happening and find out how you can actually join those events. And then finally, as Michael said earlier, our members area on the Alliance website is updated daily with the current government guidance. We've got mini guides for you, we've got the press updates for you, and we're welcome to hear from you anytime, because we will feed back your concerns, and where you need clarification, we will seek that clarification from the DFE for you. Okay, Michael, are you there?
Yeah, just a couple, just feeding back. Hope people didn't feel as though I'd forgotten them. Rachel asked about a staff member. I think this is interesting. The staff member is still at risk, not shielding necessarily, but at risk, and they can work from home. Should we encourage them to do so via the risk assessment? Just as a general comment in terms of employment, the government's guidance to all employers, if people can work at home, they should continue to do so. But in terms of how that applies in terms of an early years setting, it depends what role that person is doing, Rachel, and whether there is work that they can do within their remit and responsibility that can be done away from the setting.
Yeah, and that still stands. And I think that there's a balance now as we welcome more children back, is to see, well, actually, if we do need that member of staff in, what measures can we put in place to protect that member of staff? Have those conversations with them as you complete a risk assessment. And if the fact that they still need to work from home leaves you short of staff, as opposed to the numbers of children that are wanting places and wanting to come back, then you really need to talk to your local authority to identify how provision can be put in place while keeping staff arrangements as consistent as possible. So that's in section 5.1 of the guidance. So do have a look at that as well, Rachel.
An interesting one, I think, from Annabelle, which is sort of leading us into the sort of hybrid world that we're heading towards now. We are a large setting who occupy a large open plan, fortunately with outdoor access. I plan to still have 2 bubbles within the setting as our numbers are high. I've read in the guidance that we should adopt a method best for safety within our setting, but it states that staff can mix and toilets don't have to be separate for groups. How will the 2 bubbles I have work effectively and if staff and toilets are shared?
Yeah, I think, and it's always been the case of the guidance has always acknowledged that sometimes even bubbles would come into contact with each other. And again, this is just going to come back to how you manage that hygiene factors, really, how you can actually work it so that, you know, as soon as somebody's used the toilet, that somebody goes in and gives it a wipe round and so on. But, you know, again, it's coming back to that scientific advice that states that children are less likely to transmit the disease and are at less risk from the disease. So balancing that out against the need to try and incorporate those bubbles together.
And building on that, I think it's probably a similar answer, but it's come from Lara in terms of the specific question about taking children in a car.
Yes, yeah. The guidance with regard to that is if children are taken by any sort of public transport, which actually most people aren't really doing at the moment, that older children should wear a mask, and certainly the adults actually driving those children should wear a mask. If a childminder is picking up children in her own or his own vehicle, and again, it's about the driver wearing a mask and just really, you know, windows open if you can, or cracking the window open if you can. And I talked last time about the fact that you can actually put a cleaning mechanism through your air conditioning that will help to disinfect your vehicle as well, and that's quite useful. And I think they're called air conditioning bombs. If anybody wants to have a look at those, they can.
Okay, thank you. And a comment from Lisa. OFSTED have just announced that expired first aid certificates are to be renewed by the 30th of September. That's not something of which I was aware, but it automatically raises questions in my mind in terms of capacity of the training sector and what the social distancing and hygiene implications of that will be in terms of how that delivery has to be done for that number of people.
Yeah, I mean that's a strange one because the disapplications are in place until the 25th of September. So, you know, they may well be extended, and I wouldn't be surprised if they didn't extend them actually. So, and in that case, the paediatric first aid certificates, there would be that extension on them. But I suppose you can only extend them for so long before it becomes unsafe to do so. And St John's Ambulance, actually, for anybody who need to update, we were talking about this the other day, actually, that they have put some additional stuff on their website, though, so that people can actually just sort of refresh their knowledge a little bit as well. So that might be helpful. But yes, there is going to be a huge issue over capacity. So you need to be thinking about this now. And you need, if you can't access that first aid training, you need to show how you've tried to do so, the measures that you've taken, and the measures that you've put in place to make sure that you've got at least somebody that's got, if not paediatric first aid, then I think it's called the health and safety at work. But again, in the welcome back path or in the disapplications and modifications as well, the EYFS, there is more detail about what you can do to actually overcome that.
Thank you. I think we're beginning to move to the end of the questions now. I think what's come across in terms of the questions and other comments that have been made, it is back to that point around it is for us to now think this through from our own particular provisions perspectives. It is not against the law to do X, Y, and Z, but clearly our responsibility has to be to make sure the children and the families are safe when they are using our services. And so I think I'd like to thank Melanie for giving us that information on which we can start to reflect and consider on our own provision, and just to see how things get taken forward, and just making sure that your policies, procedures, your risk assessments, your insurance cover, etc., remain confident for this type of services you wish to do. Unless there's anything else that you'd like to add, Melanie, we get to the point where I just sort of waffle on inanely for a period of time to see if anybody else is typing in, but I won't artificially extend the length of time that we're with us. I think people have remained remarkably focused for 45 minutes. So it remains to me to thank everybody for their attendance, to thank Melanie again for turning this information around quickly. It was only announced towards the end of last week. Louise has just asked me the question, is the perfect thing. Will the webinar be available at a later date? It will be on the website, on the Alliance's YouTube website from hopefully Wednesday afternoon, Wednesday evening. You get to that by going to our homepage and then scrolling right down to the bottom, and it says visit us on YouTube, and you'll find all of the webinars over the series there. Again, and somebody said I've messed when the Welcome Back Family Services would be available. Do we have a date, Melanie?
I think we've been holding back just a little bit because we're waiting for that additional information from the DFE. But I think you can certainly order it from now, and as soon as we're absolutely confident that we've got the right information in there, it will be sent to you.
Thank you. Some very nice words of thanks coming in, Natalie. It's very kind of you. Stephanie, thanks, very informative. Hopefully you'll be with us towards the end of July. I think it will be when we try to focus on the particular support for children with additional needs. I would just like to say thank you once again to Melanie, to everybody who took part, and to wish you all a happy Tuesday evening. Good night, everybody.
Good night.